Okay, so this is a really good question. Can AI speed the process up of picking up drug interactions? Most computer systems that do exist in pharmacies, GP surgeries, as well as hospitals do flag up drug interactions at the point of prescribing. However, it doesn't always replace clinical judgment. Let's take this particular example, which I've talked about in the video, metoclopramide and levetiracetam. So there's no actual drug interaction between these two medications. However, me being aware that this patient is taking levetiracetam, it tells me that this patient has a history of epilepsy. My knowledge about metoclopramide tells me that this medication has a common side effect of it increasing the frequency and intensity of seizures, and for that reason it is contraindicated in epileptic patients, and so that's why we need to avoid this medication, something which a drug interaction checker would not pick up. If we take another example, a patient is prescribed apixaban and we now want to give them naproxen and NSAID. The system will flag up risk of bleeding. But in order to truly assess that risk of bleeding, we need to apply a clinical judgment. So does the patient have any history of GI bleeds? Do they have any history of GI ulceration? Do they take other medications that may increase their risk of bleeding? Do they have low platelets? Do they have a low HB? There's so many other things that we need to consider that this interaction checker will not tell us. And the thing with community pharmacy is that a patient may present to you for the very first time with that prescription for metoclopramide, and you may not have any of the information about them, and so the drug interaction checker won't actually pick up anything. So you then need to think, okay, what questions should I ask the patient, or must I ask the patient, to make sure that this medication is safe for them based on the very limited information that I have. Obviously, AI can potentially help in the future to analyze this information further, but again, that does rely on integration between every pharmacy that we have in the UK, across our hospitals, our GP surgeries, our National Health Service, which is a big project in itself beyond AI, based on funding, infrastructure, logistics, all of these other things, way beyond my scope right now. But yeah, I hope that answers your question. If I've missed anything or if I've said anything correctly, then yeah, please do drop them in the comments.